How does urethritis impact your bladder health? Imagine your urinary system as a busy highway, with the urethra acting as the main road that carries urine from your bladder to the outside. When this road becomes inflamed or irritated, it can cause more than just discomfort. Urethritis is the inflammation of the urethra, often caused by bacterial infections like gonorrhea or chlamydia, but sometimes from other pathogens or irritants. Because the urethra connects directly to the bladder, any issues here can quickly affect your bladder health. One of the main concerns with urethritis is that it can make it easier for bacteria to travel upward into the bladder, leading to bladder infections, also known as cystitis. This is especially common in women because their shorter urethra makes it easier for bacteria to reach the bladder. When the bladder gets infected, you might experience frequent urination, a strong urge to go, pain or burning during urination, and sometimes pelvic discomfort. If these infections happen repeatedly or are left untreated, they can damage the lining of the bladder and cause ongoing urinary problems. Severe or repeated urethritis can also cause scarring and narrowing of the urethra, a condition called urethral stricture. This narrowing can block urine flow, leading to incomplete emptying of the bladder and urinary retention. When the bladder cannot empty properly, pressure builds up, which can weaken the bladder muscles over time and increase the risk of infections. This structural change can make urination more difficult and uncomfortable. In men, urethritis can sometimes spread to nearby organs like the prostate, causing prostatitis, or to the epididymis, leading to epididymitis. These infections can cause inflammation that indirectly affects bladder function. In women, untreated urethritis can spread to reproductive organs, resulting in pelvic inflammatory disease, which may also interfere with normal urinary processes. The symptoms of urethritis often overlap with those of bladder irritation, including painful urination, increased frequency, and urgency. These symptoms can impact your daily life and comfort, making simple tasks feel more challenging. Chronic inflammation from ongoing urethritis can lead to persistent bladder irritation, which over time might cause changes in the bladder tissue. While urethritis itself is not directly linked to bladder cancer, long-term inflammation in the urinary tract is recognized as a factor that can contribute to cellular changes, emphasizing the importance of prompt diagnosis and treatment. In summary, urethritis can influence your bladder health by encouraging infections that ascend into the bladder, causing structural changes that impair urine flow, and producing symptoms that reflected bladder irritation. To protect your urinary health, it is essential to seek medical care if you experience symptoms like painful urination, unusual discharge, or a frequent urge to urinate. Proper diagnosis and treatment can prevent complications, preserve bladder function, and promote overall urinary tract health. Remember, maintaining good hygiene and practicing safer sexual behaviors are key steps in preventing urethritis and supporting your bladder health. Always consult healthcare professionals for personalized advice and treatment options.